Hello and welcome. Today we will be discussing common questions we hear from patients in regards to fertility and pregnancy among women with a diagnosis of polycystic ovarian syndrome. So a common question we first receive is, does being diagnosed with PCOS mean I am unable to get pregnant and I am sterile forever? And this is absolutely not the case. In fact, women with PCOS have a high number of eggs and they have full normal potentials for pregnancy. However, the cardinal element of PCOS is that there is irregularities in reproductive hormones. There are irregular periods, and therefore often that leads to lack of ovulation. And so the main core or treatment to address this infertility or lack of ovulation is to induce ovulation, which is a relatively simple treatment that involves taking some tablets for a few days at the beginning of the cycle, and therefore monitoring when ovulation would happen. And we advise at a timed intercourse for the couple to hopefully fall pregnant. And this is a very successful treatment in majority of cases. About 60 to 80% of women will successfully ovulate with these simple tablet treatments. Then once they ovulated, the chances of pregnancy are similar to a fertile couple, around 25% per cycle. And there is a cumulative increase in the chances of pregnancy as we do several cycles of ovulation induction. Often a couple would require between 3 to 6 cycles of successful ovulation to hopefully achieve a natural pregnancy. Now, the second question we hear is, does insulin resistance play a role in impacting the ability to get pregnant? And clearly, insulin resistance is one of the main features of PCOS. It affects about 50 to 55% of women with PCOS. And the level of insulin resistance varies depending on several factors, such as the weight of the lady. She suffers from overweight. The other contributing factors like ethnicity and sometimes the level of their androgens. So it varies from one patient to the other, and this is why we advocate for individualized management and assessment to inform the treatment properly. We recommend always, before starting a fertility treatment, to have a holistic approach in terms of assessing the health and well-being of a lady with PCOS and try to optimize all angles, including insulin resistance, such as, for example, using metformin before starting infertility treatment to reduce the negative impact of this condition on the chances of getting pregnant and later on in pregnancy, because as we all know, women with PCOS are at higher risk of having gestational diabetes and later on post-pregnancy sometimes converting to type 2 diabetes. So having a holistic assessment is important to increase the chances of having a healthy pregnancy and reduce the risk of complications. Another very common question we hear is, at what point should I seek a specialist fertility advice if I have been diagnosed with PCOS? And as I highlighted, that not all women with PCOS will directly be infertile. Some will continue to ovulate and fall pregnant naturally. However, it's important that when you get diagnosis with PCOS to have, as we mentioned, a holistic diagnostic and assessment of your reproductive health, of your metabolic health, of your skin health, of your even mental health, so that you are aware of the implications of this diagnosis on your health and well-being, including fertility. And also another thing we advocate for is having a assessment of your fertility ability. So for example, assessing the number of eggs, the patency of the fallopian tube, and even having the partner doing a semen analysis, because then you're aware of potential barriers to falling pregnant, what other contributing factors there could be. For example, a diagnosis of endometriosis that can happen around PCOS. And therefore, you'll be more informed about what are the barriers to achieving a healthy pregnancy and how can you, what are the treatment options available to mitigate that. A lot of women ask us if I am to undergo IVF, will I have less chances of falling pregnant compared to other women? And the reality that is no, as we discussed, women with PCOS have usually high number of eggs. There are some challenges when undergoing IVF treatment or even ovulation induction treatments. So for example, there's slightly higher risk of ovarian hyperstimulation syndrome, and sometimes there is slightly higher risk of a first trimester miscarriage. And we try to mitigate these by creating individualized treatment protocol, particularly when it comes to IVF, to increase the number of mature eggs available, number of good quality embryos, and support an early pregnancy or early implanting pregnancy by sufficient progesterone to reduce the risks of miscarriage. And finally, a lot of ladies ask us how important it is to optimize weight and metabolic health before starting a fertility treatment. And as we discussed, this is of critical importance. And nowadays, we get a lot of patients coming to us seeking dietary and lifestyle support. Very recently, we're seeing high uptake of GLP-1 agonists that could be teratogenic, and someone should not get pregnant if they are on it. So we try to work with them to create a clear, structured plan of action, understanding their current barrier, trying to optimize their weight, trying to optimize their supplements, make sure they have high levels of iron, for example, high level of vitamin D and folic acid, and reduce their weight and having as low insulin resistance before we start any fertility treatment. So help them achieve a healthy pregnancy with no complications whatsoever. And that obviously empower them to be healthy mothers, caring for a new baby, and we continue to work with them for the long term, even beyond the pregnancy. I hope these answers are of value. We hope to hear from you soon.